Welcome to Health and Wellbeing Live, sharing knowledge and experience from Nottingham City. We are keeping people informed about issues, people and services supporting health and wellbeing across the city of Nottingham. And today we'll be talking about supporting people to make healthy life choices, in particular to eat and move well for their health. Just a reminder that this is a relaxed podcast style production. We're pitched at an interested and informed audience, but there'll be little dumbing down and this will be an in-depth conversation, but obviously open to anybody out there to listen and learn what we're doing in Nottingham. Today we'll be talking to Ruth Bell, who is the Public Health Programme Manager for Eating and Moving for Good Health. We will be talking to Jennie Maybury, who is the Transport Specialist for Behaviour Change and Travel Well, and we'll be talking to Asia Asghar, who is the Active Wellbeing Officer. And I'm Dr. Andy Foster. I'm a GP who works in Nottingham. I am a director of NCGPA, and I'm the Deputy Director of Place-Based Partnership. Just get those declarations of interest out of the way. So we've got three people on the call, more than we usually have. Do you want to introduce yourself? So we'll start with Ruth.
Hiya. So I'm Ruth Bell. As Andy said, I'm the Programme Manager for Eating and Moving for Good Health within Nottingham City Public Health.
Fantastic. And Asia?
My name's Asia Asghar. My role is to work and engage with South Asian community within Nottingham. I work with the Scale Can, Active Not and Nottingham Muslim Women Network.
Great. And finally, Jennie.
Hello everyone, I'm Jennie and I am the Programme Manager for a new national pilot called Travel Well in Nottingham, which is about achieving active travel through social prescribing.
Great. So and I guess the theme across everything is that making healthy choices and eating and moving well for health. We thought that a good way to start would be actually just to have a think about the problems as we see them in Nottingham with respect to these issues from our perspectives, I guess. And I'll start. So I'm a GP, and I guess what I see is people struggling amidst their day-to-day lives in the area where I work, so that's Bulwell, struggling to make healthy choices about their lives, struggling to eat the right foods, struggling to exercise, struggling to perhaps avoid things that are bad for their health as well, struggling to make those social connections, keep those social connections that are good for health, all of those things. Another thing I see is perhaps the environment that people in my area of practice work and live is not necessarily conducive to good health. I see people perhaps making transport choices, rather than walking. They might be using the car a lot. They might be using mobility scooters, more than might be helpful for them in the long term, actually. And when I look around the high street, I'm not necessarily seeing healthy food outlets. I'm seeing much more fried chicken, fast food, Greggs, things like that. So I can see that the environment's not that helpful. And I just sort of think, what a missed opportunity, because so much of the focus at the moment and for a long time, in health is around health prevention. And actually, if we can help people make healthy life choices, keep a good weight, keep in good condition, keep active, avoid those things like smoking that make them unhealthy and are absolutely awful for people's health, then people can live longer, people can avoid getting long-term conditions like diabetes, respiratory illness, obesity, and can live longer and more active lives. A big missed opportunity, but I guess that's where your work is focused. So I guess if we go to Ruth next, how do you see the problem, in your role and with the people that you work with?
So I think kind of just building on what you've sort of already said, really, Andy. There's a lot of people actually really want to eat better and to move more, or it's sometimes from a sense of obligation, like they feel like they should be doing it, or sometimes genuinely just want to make really healthy changes for themselves. But it's not always the easy choice. I think people face a lot of barriers sometimes to being able to make those changes. And Nottingham is a great city. I love it here. But we have quite high levels of deprivation across the city, and that presents many challenges for a lot of people. health behaviours, I guess, are quite complex and they tend to kind of cluster. So people are often not just trying to overcome one health behaviour, it might be multiple all at the same time, but where people feel like they need to make improvements. And if your mental health or well-being isn't in an amazing place, it can make it much harder then to make those make the changes around being physically active and eating better, even though they're obviously all interconnected. Changing one thing will help another, but when it's a whole, it feels sometimes like a big overwhelming amount of things that people are trying to work their way through, a huge amount of barriers that people are trying to overcome to be able to make those changes.
Yeah, you know, Ruth, I've just realised the first thing I should probably have asked you is actually explain just a little bit about your role in particular. You know, what are you doing day to day, and what contact are you having with people?
Apologies. So, yeah, that probably would have been a helpful start that I didn't go into. Sorry. So, my role is, as I said, I'm program manager in public health. So, I kind of look after the and coordinate the delivery of our Eating and Moving for Good health strategy and delivery plan. So we have a 10-year strategy and a 3-year delivery plan made up of the actions that we are trying to deliver. And I guess it's a combination of doing what we can to change some of the environment in the city, working with other partners as much as we can on that, although obviously that can be quite difficult, and we're also providing services to address people's needs, so things like weight management services and sort of health initiatives in schools and those types of things.
Great, good. Well, and I guess we might come back to some of those in a minute when we start talking about the sorts of solutions that you're all putting in place as part of your programs. I think I'm going to go next to Jennie and just ask Jennie, yes, first of all, just give us a bit of an outline of what your role is, and then it'd be great to know kind of what problems you see people experiencing in terms of trying to engage with your work.
Okay, thank you. Well, currently I'm the program manager for one of 11 national pilots in England around looking at how we use a social prescribing approach to support people to make active travel choices. So to do more walking and cycling for local journeys. And the reason we've secured this money for Nottingham is because obviously there are many communities, particularly women, where there is very high levels of low healthy life expectancy. We have an enormous inactive population, around 65,000 people, according to one of the physical activity surveys. So there's basically a huge opportunity out there that where walking and cycling could really help to address some of these issues and provide people with healthier sort of lifestyle options. But at the same time, we've also received a lot of investment in our walking and cycling network. So we've got fantastic facilities around the city, but not everyone is able to engage with that for some of the kind of reasons you've already flagged and Ruth touched on as well. So really what the programme is about is how we give people the opportunity to actually benefit from the investment we've had in the walking and cycling services. How do we actually support people to do more walking and cycling, to get out on their bikes and address barriers that they may have to doing that, and how we remove those barriers?
Yeah, that's good. I got a greater understanding now of what you're up to. It was just occurring to me. So tell us a bit more about the barriers. So what do you think stops people engaging with those programs? Or making those choices?
As part of the work we did prior to securing the funding, we carried out quite a detailed feasibility study with 64 different stakeholders to really kind of drill into what some of the issues and barriers might be. And it's really around people needing both practical and kind of emotional support to actually make and sustain a change in travel behaviour. They need the motivation, they need the inspiration, they need that ongoing encouragement and support. But there are also practical barriers to do with kind of cost of living and access to bikes, the cost of clothing and equipment, kind of terrain, but also people's confidence as well. So what we've tried to do is, through Travel Well, is develop projects that actually address some of those issues and make a really kind of welcoming, friendly provision that also provides people with some of the kind of equipment and skills and confidence they're going to need to actually start walking or cycling.
Thanks, Jenny. I really like that way of breaking things down into the kind of the material and practical considerations, and then that emotional dimension as well. I certainly see both of those, perhaps more that emotional barrier to engagement when I see people in my surgery. So let's go next to Asia. And Asia, do you want to tell us a little bit about your role, and then a little bit about the kind of problems or barriers that you're encountering?
Yeah, so my role is engaging both with the South Asian community within Nottinghamshire, predominantly women and girls, and seeing what barriers they face, and literally seeing it from, instead of getting it from the hierarchy delivered down, it's working from the grassroots and saying this is what the problems they face. Even though what we discovered that a lot of sort of activities and programs were implemented within the community, but they weren't tailored. So therefore, they weren't having the success rate that they should have, due to fundamentally missing out core elements of the importance for the women to participate and to make it a lot more successful. We know we live in such a diverse community within Nottingham itself, with over like 34.6%. So it's important, I think, knowing what the community wants and what is needed, but also having the bridge and working with partnerships so they have the insight as well, for when they're implementing their programs, to be mindful of what logistics they need to put in place. Because if it's set out there and if it's not reaching the community or the people that you aim it to reach, there's obviously something missing, and it's literally building that link between the two, and hopefully making the programs more successful, which we have, because I kind of do cycling, swimming, badminton, football, and try to get them a lot more engaged in sports that probably wouldn't participate but want to.
That sounds like really great work, and I can see the need for that. I was going to just ask a question actually. So we've got Jenny, who might be interested in getting more of everybody to use cycle paths, cycle to and from work and from the shops. And you mentioned cycling as an area that you've been able to make some progress with. What sort of things did you need to do or address or take into account to make that solution more relevant for the group of people that you work with?
So to be honest, when we initially, I was on the panel for the cycling, it was important for me to make the partnership aware that cycling in itself culturally isn't a traditional way of transport. So it's changing not just the physical but also mental behaviour of the community that we're sort of approaching and want to work with. So it was making them aware that they won't have access to bicycles due to where they're living, storage, maintenance, and just generally with the expense, because cycling itself or bikes is classed as more as a luxury item than actually the need. So it's making sure that it's available for the women to participate. And a lot of the cases, a lot of the ladies don't know how to cycle. So cycling sessions were out there, but they didn't actually know how to ride a bike. So it was going back to the basics, where we would have to take the pedals off and have instructors tell them how to do the bike of the bike, and then gradually do a transition into the next stage and forso. And it was making those sort of little changes and making sure it was delivered by a female, because it's a physical kind of sport and they have that interaction, making sure the women that the Mr. Women, they probably feel more comfortable if it's delivered by a female in a setting where they feel comfortable and not too exposed, and also being aware of the garments that they wear, and making sure all these elements are considered, which were, and hence why it had gradually increased in the participants, because for them, it's seeing is believing. So when they saw more women out there visually being present, they interacted more to the sport and the event.
That's really good. And you raised a lot of things there which wouldn't have immediately been obvious to me, you know, I guess as a white male, that need to be there to ensure that everybody can participate in a plan. So it really shows to me the value of having, you know, that diversity there when planning these sorts of interventions. So I think it feels like there's a really important lesson there for anyone sort of planning, you know, an intervention or a scheme going forwards. So thanks for that, Asia. The next question that we'd agreed to talk about was, now, given that we've identified there's a big opportunity, you know, to improve people's lives through greater engagement with moving well, choosing the right mode of transport, making good food choices, what solutions are being put in place by your programs to help people with these challenges and to realise those opportunities? I think we'll probably go to Jennie first. What sort of solutions or successes are you seeing?
Okay, well, through Travel Well, we've kind of got 4 levels of activity provision. It's not all quite on stream yet, but it is coming. So first of all, we're kind of providing community level family friendly provision. So the focus is how we engage women who are often carers. So we wanted to make sure that the provision we provide is family friendly, and that will offer kind of regular activities actually within community venues that people are familiar going to, creation of cycle hubs, and providing local walks and rides so that people know that there's something happening in their area. They're in places that they would normally go and engage and with you know, other people from their communities. Then we're also providing a range of kind of small group and one-to-one activities as well, so that's providing that much more tailored level of activity for people. So that is very specifically about kind of supporting them as an individual, kind of, you know, picking up on the kind of, you know, personalized care and what matters to me. And then we've also doing some quite specific interventions, working with Nottingham University Hospital Trust. We're looking at 2 particular outpatient cohorts there, needing to support, for whom more physical activity would be beneficial, and that is adults with non-alcoholic fatty liver disease and women with gestational diabetes. So we're looking at ways to support, like walk and talk offer for those 2 groups, and that's kind of evolving at the moment. And then very finally, we're also planning to provide taste trap activities for social prescribers as well. So we're really keen that we actually also help the social prescribing workforce and other people who are kind of influencers out in their community to actually really benefit from themselves and the benefits of walking and cycling, and that will hopefully make them really good advocates then in their communities or with their patients or with the people that they're working with. And overall, we're very much, you know, again, drawing on what Asia has been talking about, really making sure that the activities are delivered in areas by people that are representative of the communities we're trying to reach. And we have some particular projects which are very much about trying to develop the skills in those communities themselves. So we're looking at a Dr. Bike Champions programme, which is just kind of getting going now, where we'd actually have a core of people trained with bike mechanics to actually deliver Dr. Bike services out in their communities. And the provider we're working with, Nottingham Bike Works, for that, they will be drawing those people from within the communities we're working in. And also, again, building on a lot of the good practice, and one of the examples Asia's just spoken about, we're looking to develop 10-week cycle confidence training courses with the opportunity for people that take part in those sessions to then go on to become ride leaders. So again, we're looking to really equip people who might, you know, just, you know, start getting active for their own benefits to start with, and then with their family, but actually how they can really become someone who's, you know, in their community, helping other people from their community to actually start to engage in those activities as well. So we're really keen to kind of develop the projects in that way.
Wow, so it sounds like lots and lots of things going on, and just a few. Ask you can come in a second, but there was a few things that I was just reflecting on that sound like really good practice for people who are designing programs. So I really liked that idea of involving and training those people who have contact with the community. So you mentioned the social link work prescribers. I thought that's a really good way of extending the reach of what you're doing, and also getting people referred kind of into your service. And then just that kind of deep community engagement and involvement that came through again was really, really good. Asia wanted to come in or ask a question. Go ahead.
No, it's just not asking a question. I was saying it's really, I think what Jenny has touched based on, we've also kind of worked when it comes to workforce, so of people that participated in the events that we've set up, we've kind of upskilled the ladies from there. So it really is proven to be really, really successful when someone that actually looks like them and represents them that's actually delivering their sessions. So it's proven that they can relate to them a little bit more, and there's not much of a gap between the deliverer and the participants as such. But also it gives them that kind of unity within the community and the trust base, which is most important when we're trying to get to the most hard to reach communities.
That's great. There's so many good lessons in this conversation today about good engagement and delivering good, effective community projects. I'm really enjoying it today, actually. Asia, we were going to come to you next with that question about what solutions you're putting in place, or what successes you're having, and trying to keep us on pace. So just a few minutes, if that's all right, Asia.
Yeah, so we've kind of done it slightly. I've taken a different avenue where we've kind of approached the faith leaders within the Nottinghamshire, which hasn't been really approached from that angle, because we feel that sometimes the same message can be delivered and digested in a different manner than it is from a different organisation. So we're kind of working with faith leaders, as well as working with partnership with organisation to making sure that the sessions are more constructive and more adaptable to the community that we're trying to reach out to, but also getting more visual aid out there, which is I think is a major help within the community, where they can see someone visually available, being it posters or in talks and or awareness. Having someone that represents someone from their community always I find works well. So we're trying to go down that avenue.
That's really helpful, Asia. And what I'm seeing today is that actually, I thought we were going to have a conversation about the specifics of the benefits of getting people on bikes, moving from A to B, and we're making certain food choices. But actually, this is more about the engagement of people, isn't it? Because actually, what people should be doing is quite simple in some ways, but it's why they're not doing it, and how can we engage them better with the projects and the programs. That's the real thorny question here. I'm going to suggest that we go to Ruth next, and just ask you that same question, Ruth. What solutions are you putting in place? And we've heard some examples of good practice, actually, so it might be that there are some things that you think are going particularly well that you can share.
Yeah, sure. So I guess we've written the strategy to try and cover 5 areas, because eating and moving is quite broad. Like there's quite a lot that comes under that. So we're looking at what we can do in kind of early years, schools, education. We are looking at how we can support healthy weight throughout people's life courses. We're thinking about how we can build environments that support physical activity, and we're looking at how we can structure environments so that they support kind of healthy food choices as well. And really importantly, we are also looking at how we try and make our food system in Nottingham as sustainable as possible, with an angle on financial well-being. So just kind of crossing over into that area, because we know that a lot of the reasons why and a lot of the barriers that people face to making those food choices are rooted in financial concerns, because it can be quite expensive to eat healthy food. I think there was some research that showed that for a fifth of households in the UK, in order to eat the government recommended diet, they would have to be spending about a half their income on food alone, and it's much cheaper per calorie to be buying food that isn't as nutritious, essentially. And obviously, in the midst of a cost of living crisis in a relatively deprived city, anyway, well, very deprived city, those that really is having an impact on people. So we have to consider from that angle, definitely.
And I was wondering, Ruth, is there any sort of one or two things that you feel you've really been able to kind of make progress with or make a difference, you know, things that are beginning to work in your kind of field of work?
So we've really we've invested across the board in all of those areas, really. Some of the things that we've done which feel very positive are we've recently commissioned a healthy schools team that are going to sit within education, so they're going to support schools who want to make changes and recognise those with an award system. Sitting alongside that, we've commissioned a survey for schools around health and wellbeing for pupils, so they can, and the schools will get the results, which are all anonymised, but they can then see where they're doing really well and where they might need the support, and then they've got the team that they can come to in order to get that additional support. We've also we've had 5 weight management providers working across the city. So they all offer something slightly different that have been in place for the past year and have all been doing an amazing job supporting people to make changes to improve those kind of diet and exercise behaviours. And we've recently commissioned the integrated wellbeing service for Nottingham. So they will be taking that over. That work on, but they will also be bringing in other services as part of that, like stop smoking services, and we're hopeful that having that more integrated approach will be really maybe a bit more a person-centered approach, I guess, to help people kind of meet people where they're at and tailor maybe an individual journey that people need that's going to really help them to make changes. And they will also be providing some weight management solutions for children and young people as well, which is something I think that we've needed.
It's good to hear about all that work, and it's interesting that you identify that opportunity. I think it's Thrive Tribe, isn't it, who are coming in to provide that. Yeah. I'm quite excited as well about that integrated service. It's one of the challenges that I've found, particularly with weight management, is because the providers sort of change over time. It's very difficult as a clinician to keep track. But if actually you just put your referral into one place and they then connect with who are the active providers, that feels much more better, much better way of doing it. So I'm going to move on to the final questions. So I've got a final question for each of you, really. Fairly quick fire, and probably looking for some tips in areas that I've sort of picked up. You seem to be doing quite well in each of your fields. So I'll get to ask you first. And do you have any tips for people running programs out there who are looking to engage with, and I'm going to use the term hard to reach groups, and for people listening, I'm using kind of air quotations there because I'm not sure that that's quite the right term. But any tips for people engaging with, particular groups that have traditionally been difficult to engage with these programs?
Yeah, I think the most and foremost, most important is that you have to literally go down and engage with them. You have to break bread with them and literally have the conversation. So it's not done in a hard setting. You're just literally there for the coffee mornings, having a normal chit chat, actually getting to know the ladies or getting to know the people that you actually want to work with. So you have a clearer understanding of what is needed. And I think that's when you can really develop and build a relationship within the community or the group that you really want to work with, because you actually know the insides and out, and you have built a relationship of trust, a relationship of sort of loyalty, and that's where you'll get a lot more engagement, and you'll have a more of an insight and understanding. And it's always, I think, when you get to sit and have a normal conversation where you get the best insight and information that's required in going later on and implementing a project or writing up a project, because then you actually know what to be mindful of, and then just literally delivering what is required and what is needed. There may not be what you think, what's actually is what they want. So actually giving them what they want.
Really good. Really good tips and guidance there for the projects going forwards. I think I'll go to Jennie next, and it felt like you were doing quite a lot to raise awareness of your schemes and some really innovative ways of doing that. Do you have any tips for people out there with running a program who are feeling challenged by raising awareness of what they're doing?
I think, well, it's probably touching on some of the things we've already talked about, really. I think it's really important that you get the groups that are already trusted and active in the community to actually be the kind of advocates and the voice out to those communities about what the offer is, and that they're part of that offer. And also, you can't just rely on online communications. You need to have that, as Asia's already talked about, that kind of face-to-face approach, getting out into the actual groups, but providing the posters, providing leaflets, and providing some case studies as well. What we're trying to build up is a series of monthly blogs, so we're hoping to kind of get representatives of different groups to actually talk about their experience of starting walking or starting cycling and what it's meant to them, to sort of hopefully inspire people out there. So there's a number of different approaches that we're kind of developing to sort of get the message out and inspire people to get involved.
Thank you very much, Jennie. And just maybe to Ruth. So Ruth, you've got probably the most difficult question, actually. The question is, I got the sense that you were thinking about sustainable change by going into schools, for example, and getting people early as they're developing their eating and their moving habits. And I just wondered if you had any thoughts about how we can make these sorts of changes sustainable. How can we make them stick going forwards? What are your tips on that?
Well, I think, as you've mentioned, we have put thought certainly into how we can influence health behaviours at quite a young age. We've also put some work into supporting people who are sort of starting families. So we're working quite closely with SSBC, and they're doing a lot of work around Healthy Start as well. So making vitamins available for pregnant women. We've funded that, so that's now for all pregnant women in Nottingham City, one course. And we've also they're promoting for us really nicely the Healthy Start vouchers, which can really help out with those people who are on the lowest incomes in terms of being able to get milk, fruit, veg for their babies and toddlers. So that's the so we've definitely tried to do those things in terms of embedding things from an early age, and we've sort of been thinking about it across the course as well.
That's great. I'm sure I can remember when I was in primary school, having some lessons and receiving input about healthy eating, and actually I think it really does make a difference. We can all think back and think about how receptive we were to messages at that age, and it's easy to forget how important that is if you've not been in education for a long period of time. So moving now to the very last question. So everybody that we have on the podcast, we ask the same question at the end to wrap up, and that question is, what should people do, or what would you like people to do immediately after finishing this podcast? What's the next action that you would like them to take to move themselves forwards on the topic that you've been talking about? So in no particular order, we will go to Asia first.
Yeah, I would like you to come to our coffee mornings that we have set up around Nottingham, and also activities. You can find out where these activities are based for the Nottingham Muslim Women Network, and just come and have a try, or just come and have a coffee, have a chat, and we're here to listen to you and be your voice, and try to implement that movement and healthy well-being to the way they feel that works best for that community. So that's I would say, yeah, go and check Instagram or Facebook, and then or drop an inquiry if there's anything you want, any information, any signposting. We're there to help.
Oh, thank you very much, Asia. And let's go to Ruth next.
Well, you know what I was going to say as a joke to everyone to just get up and do 5-star jumps, but actually, I don't know if it is that much of a
It's
joke,
not a bad
because
one. Yeah.
because in reality, as professionals, like research shows, we feel a lot more comfortable recommending physical activities to other people when we're doing it ourselves. There's a degree, I think, of sometimes we can feel a little hypocritical if we're trying to recommend something we're not doing. So I think if we all challenge ourselves to do a little bit more, I think it helps us to support and encourage other people to do the same thing as well.
That's a really good challenge for everyone, Ruth, and I'll do that when I get off this call. Finally, to Jennie. So, what would you like people to do immediately after finishing this podcast? What would you ask?
Okay, well, sort of building on what Ruth suggested about getting active yourselves, please download our Go Jauntly app, which is showcases a number of really local walks in our Travel Well delivery areas in the city under the Travel Well collection. It's free to download, Android and iPhone, and those walks are available now, plus a range of other walks across Nottingham City, and we're building that collection all the time. And if I have two things, to also please go to the Travel Well pages on Transport Nottingham website to see more information about the referral routes into the Travel Well programme, that hopefully so you can spread the word amongst your colleagues and kind of use with your kind of patients and contacts.
Thank you. So thank you so much to all three of you for sharing your insights and knowledge with us, and with the audience. And thank you very much to the audience as well, for tuning in, listening, and staying with us. Hopefully they'll check out some of the other similar podcasts that are available on the same channel that they're listening to us on at the moment. So thank you very much, everybody, and hopefully we'll see you again for another episode in the future.